Joining us on the phone now is Dr. Debra Braverman with the Cardiology Division of the Albert Einstein Medical Center. Dr. Braverman, good morning.
Good morning. How are you?
Wonderful. Thank you for joining us. A fascinating story I was reading here. Wanted to talk to you about something called ECP therapy. We know how important exercise is in keeping people healthy and for treatment of certain things. But this is fascinating. You just have to describe it to our listeners.
Well, basically, EECP, which is Enhanced External Counterpulsation, is a non-invasive treatment for heart disease, which usually attracts a lot of attention because when we think of treating heart disease, we think of surgery and stents and angioplasty. Here we're talking about a non-invasive treatment. So basically what the patient does is lay down on a special bed, and we take what amounts to oversized blood pressure cuffs, and we wrap them around their legs. And in sync to their own heartbeat, these cuffs squeeze and release the leg muscles, massaging the leg muscles, which stimulates blood flow from the legs back up to the heart. And that increased blood flow, as if you're exercising, it's a passive form of exercise. Getting that blood to flow helps to open up tiny little underutilized arteries in and around the heart, and that restores normal blood flow to the heart beyond those blockages where the heart really needs it the most.
Understand this question. I'm a layman. Is exercise used as a treatment for heart disease generally?
Well, absolutely. That should be the number one treatment, preventative measure, as well as treatment for heart disease. But the problem is that most people who suffer with heart disease are too symptomatic. They're really not able to exercise to the degree that they can really make major blood flow changes. And that's where EECP comes in. It's a bridge to allow patients to reestablish normal blood flow patterns, and then that allows the symptoms to dissipate, and they can then participate in a more active, ongoing exercise regimen.
Someone here listening in the Phoenix area this morning, would they have to travel thousands of miles to get this? Is it available across the country?
Yes, it is. It's available at over 600 facilities around the country, and the best way to locate treatment in your geographical area would be to go online to eecp.com, and there you can locate local treatment.
Would this be, Doctor, would this be something that would work for people who might have asthma, maybe overweight, and they can't really exercise, but they should? Would they get benefits from this as well, or does it just help heart disease?
Well, it's primarily a treatment for disorders of circulation, and asthma is not related to blood flow or circulation. That is a primary lung disease. So, no, it really wouldn't be a treatment for that. It's a treatment designed particularly for heart disease sufferers, of which there are many, of course. We know heart disease is the number one killer of men and women in this country, so it's ever present, and this treatment is designed in particular to normalize blood flow.
What percentage of heart disease is self-inflicted in certain ways?
Gee, we don't really have those clear-cut numbers because there are sort of two aspects to developing heart disease, and one is your genetic predisposition. That's something you can't control. And then, of course, there's lifestyle components, and they interact and intertwine so intimately that we really can't tease out one or the other. But there's no question that particular lifestyle choices accelerate and worsen heart disease, and by ameliorating those choices and making the right choices, you can stop heart disease dead in its tracks and even start to reverse the pathology that is so concerning to so many.
Dr. Braverman, I'm sure you've seen patients, or maybe you have administered this EECP therapy yourself. What results have you seen? What reaction do you get from the patients after they've had it?
Well, that's really my favorite part of my job is when I get to observe these patients coming in with chest pain, shortness of breath, fatigue, all kinds of limitations and symptoms, and watch them literally transform as a result of EECP back to their old selves, that they're able to participate in their leisure and work activities. They don't have to always think about being a heart patient and worrying about their heart condition. They can just go on and exercise, be active, live their lives. I've seen patients go back to tennis and golf and skiing, certainly going back to work and doing more mundane things like taking care of their home and doing errands and all these things that they had trouble doing before. Now they're able to restore a normal quality of life once again.
Are there a typical number of sessions they have to go through before they can get back to that situation again?
Yes. The standard course of treatment is 35 one-hour sessions. So each treatment is 1 hour, and typically it's 5 days a week for a period of 7 weeks. So it's a 35 treatment program. And the reason for that type of dedication and repetition is based on the same principle as regular exercise. We all know that if we exercise once in a while, you're not going to get any result. The body requires repetitive physiological stimulation in order for it to make a change. So it's this repetitive blood flow over and over and over that's really required to wake up these arteries and help them to become reestablished so that they last for literally years to come.
And the results of doing this therapy, very similar to what you would get if you took a half-hour brisk walk or a slight run around the neighborhood. Is that right?
It's actually more equivalent to high-level exercise, like running marathons, that kind of exercise.
Wow.
That's really the way we're jump-starting the circulation. If you look at it on a cellular level, doing the 35 hours of ECP is equivalent to 3 months of high-intensity exercise training. So it's really a major jump-start to get these people back on track.
And once again, tell us how to find out where you can get this therapy if you need it.
Yes, you should go online to eecp.com, and on that website, it's very clearly delineated that you can find local treatment in your area.
Very good. That is very encouraging stuff. Dr. Debra Braverman joining us this morning. Thank you for being on the show.
Absolutely my pleasure. Thank you.